Good morning, everybody. I've been asked to do something which is actually something we do every day in our practice, which is consultations. And really, the purpose of a consultation is for a patient to come in and ask questions about, things that they're interested in, which is usually stimulated by concern that they have about how they look, because as I've said before in previous videos, the aging process is something that nobody can teach us. We have to experience it ourselves, and it's not comfortable psychologically. And so, although it's unique to everybody when they go through it, it happens to everybody. Okay, and again, we're dealing with this every day. So the first thing I'll ask a patient is, what their health history is. We want to know that because, aesthetic procedures are elective, and they often require sedation, and so we want to make sure we're dealing with healthy patients, and we don't want to put anybody at risk because safety is job number one. Okay, and then of course I ask, what your concerns will be are, and for somebody with let's say an aging face situation, I'm going to show you a case example of somebody who's in her mid 60s, who gained a lot of weight, then lost the weight, and told me, I want to look like the way I used to. And I say that because she was actually telling me that she wants to generally look much better than she does, and to utilize the tools that I have available to do so. Okay. Not everybody asks that. Some people say, it's just my neck, my jawline, or my eyes, or I look tired or something like that. But I do, before I move on to the individual, just discuss the neck. After you reach a certain point, it's usually sometime in the mid 40s to late 40s, the skin really cannot accommodate changes to the neck alone. So limited incision procedures on the neck then are no longer applicable to most people, let's say in their 50s, 60s, and 70s. And we need to address the cheek, the jawline, and the neck together, okay, with what we call a deep plane facelift. And again, that's just because of the laxity in the skin. And limited incision neck procedures are limited in the amount of skin that you can remove and the results that you can get. So that's a very specific point. So after discussing patient's concerns, then we move on to discussing the procedure and how I do it. And then, of course, I will show patient examples. And this is just, I'd mentioned before, discussing an individual patient. This is a woman in her mid 60s, again, concerned about her jowling, her neck, jawline, her skin, eyelids, and brow position. So we ended up doing a deep plane facelift, fractionated CO2 laser resurfacing, upper and lower eyelid surgery, and a brow lift to globally address her concerns. Okay, and so I show this because this is an example of somebody who wants to look globally refreshed, and you can see how that's accomplished again in the lateral view. Okay, and then of course in the other 3/4 view. So I will show a variety of examples of patients that are somewhat similar, because I can show age ranges and different types of morphologies of facial features and neck features. After describing that, we will describe a little bit of the downtime. I'll do a separate video on that. Downtime is downtime, and we never gloss over that. We want you to be prepared. We also affirm the fact that if you decide to do a procedure with my practice, we'll have you come back for a preoperative visit where we outline all of the things that you're supposed to do so you are prepared for the surgery. And then I go through the risks of the procedure. For example, with a facelift, my standard way of discussing risks would be I discuss the risk of bleeding, infection, scarring. Blood loss is minimal. Infection is extremely rare. Scarring, you will have scars. The idea is they will look really good, look something like this, and they're very hard to see, in other words. Basically, in other words, not very easy to see. And my joke, although it's not a joke, it's true, I don't want you going around saying Dr. Prendeville did this to you, okay? Risk of hematoma, which is a collection of blood underneath the skin. If it happens, we'd have to go back to the OR, so we'd rather avoid that, okay? And most patients are actually very good and compliant. Risk of facial nerve injury. Facial nerve is a power cable to the facial muscles, allowing you to move your facial muscles and animate your face. It's actually branches, which should theoretically be at risk. What I tell people is it's like the Florida power and light engineer that comes out to your house. I know where the power line is and I stay away from it. Facial anatomy is actually very complicated, but it's very consistent. So we know where things are. And if you're dealing with a surgeon who has done a lot of facelifts, and I've personally done over 1,500, you're going to be in a very safe situation. Okay. Risk of hair loss, theoretically, in incisions in or close to the hairline. We're not putting a lot of tension on the skin, and we're not using a lot of cautery on hair follicles, so that really has been a non-issue. You will definitely have some sensory loss in this area here and under here, okay? And that can be usually for a couple of months, but generally up to a year. It's not one of those things that bothers most people, but it is good to know about, especially for men. Men have what are called hair-bearing shifts, in shaving, and so we want to make sure. Here's a picture of a gentleman that we did a facelift for, and he's actually about 6 weeks out, but you can see before and after. But if you look kind of closely, you can see the way the hair is a little closer to the ear, and so men will be asked to shave with an electric razor for about a year afterward. So that kind of sums up the things we talk about, and then as far as scheduling, etc., I'll have you discuss that with my office manager and patient care coordinator. And obviously, you have to make sure that the schedule aligns with what's going on in your life. A facelift or facial rejuvenation is not something to do a week before a wedding. Okay, so if you're having an important event, you might want to do this 3, 6 months, a year ahead of time, so you have enough time to recover and you feel comfortable with how you look. Another aspect in recovery that is not frequently discussed on the internet is what I describe as psychological recovery, and that's when you feel good about how you look. Okay, and that can depend on the individual. This is somebody here who's at a month after a facelift, and you can see by the look on her face she's happy, so she's in the mode of psychological recovery. Okay, when she comes here at 1 week, she's really not, because she's still undergoing the process of the physical healing. Okay, again, compare that to 1 month and you can see the way she looks there. Okay, so those are all things that we'll discuss, and that's kind of an abbreviated form or short format. If you do have any other questions, we'd be very happy to see you in consultation. And my staff are fantastic. They can answer pretty much any question that comes up. Thank you very much. Bye-bye.